I'm Dr. Judson Brandeis, and today we're talking about Peyronie's disease. First, I want to tell you about one of my patients named Bruce. Bruce was finally in a good place in life. He had just turned 50, and he and his wife Melanie were sending off their boy-girl twins to college. Between work and college applications, the last few years had been hectic. But Bruce was finally able to sell his startup IT company for a hefty sum of money. And he and Melanie were looking forward to an empty nest and traveling. Bruce took one twin off to the East Coast for college, and Melanie took the other twin to the West Coast. They both arrived home from their college trips at the same time. When they finally sat down on the couch with a glass of wine, the silence in the house was deafening. Melanie glanced over at Bruce, who was checking her out at the same time. All of a sudden, it was like they were newlyweds again. Empty nest and financially secure, they finally had the time to enjoy each other's company without kids in the house and job stress. Bored with the missionary position, they began to experiment. One afternoon, Bruce heard a snap and felt a sudden pain in his penis as the blood quickly departed. Alarmed, Bruce immediately consulted the internet. Because he didn't have any swelling or bleeding, Bruce didn't go to the doctor. He read about taking vitamin E for 6 months and figured it was worth a try. He and Melanie abstained from intimacy for 3 weeks and then started back gingerly. Things seemed to work okay, but they were somewhat less adventurous since Bruce still had some pain. A month after the incident, Bruce woke up one morning with an erection and noticed an upward curve. Over the ensuing month, the curve continued to get worse and the pain continued. Ashamed, Bruce didn't share this issue with Melanie. Instead, he withdrew from physical intimacy, continually making an excuse to avoid situations. Soon, he and Melanie adopted 2 stray dogs, and Bruce joined another startup IT company, and Melanie chose to go back to work as well. Approximately 1 of every 20 men above the age of 40 developed a curved penis called Peyronie's disease. Unlike Bruce, 4 out of 5 men don't even remember any specific event that led to the disease's development. The underlying lesions of Peyronie's disease are fibrous plaques of scar tissue that contain excessive collagen and fragmented elastic fibers that alter penile anatomy and its ability to stretch. Over time, the plaques may become calcified and rigid. The stretched length of the penis shrinks and the curvature increases. Peyronie's disease resolves on its own in little more than 10% of cases. And it's not uncommon for men to be unable to have satisfactory intercourse because of the curvature. Peyronie's disease can be physically and psychologically disabling, leading to a lower quality of life. Patients are encouraged to initiate treatment as soon as possible once a doctor makes the diagnosis of Peyronie's disease. There's an association between Peyronie's disease and Dupuytren's contractures of the hand, which is also a disease of collagen. A history of genital trauma, prostate surgery, and diabetes has been associated with the development of Peyronie's disease. Untreated Peyronie's disease improves in only 12% of men, with almost 50% of men demonstrating worsening of the curvature at 12 months. Presenting symptoms include penile pain and possibly a nodule or plaque, indentation, curvature, deformity, or shortening of the penis during an erection. Sexual dysfunction may also occur. Peyronie's disease is most evident during an erection. Severe and complex curvature and compromised penile rigidity make penetrative intercourse impossible. Patients in the active phase of the disease experience pain with an erection and curvature changes that rarely benefit from oral medication. The only drug that's shown any benefit is pentoxifillin 400 milligrams 3 times a day. Pentoxifillin decreases fibrosis, prevents the deposition of collagen, and reduces calcification in experimental animals. Studies show that oral medications like colchicine and tamoxifen are not helpful, nor are supplements such as vitamin E, PABA, and carnitine. The only FDA-approved non-surgical treatment for Peyronie's disease is an injectable medication called Xiaflex. Xiaflex is collagenase, an enzyme that dissolves collagen, which is the scar tissue's main component. The 2 large clinical trials used to get approval for Xiaflex showed that after a series of 8 injections over 24 weeks, the men who received Xiaflex and performed gentle stretching exercises had an average change in their erectile curvature of 35%, as compared to 20% for men who had a placebo injection. Men with stable disease and a curvature between 30 and 90 degrees have the option of Xiaflex injections. A urologist injects the scar tissue with a small amount of enzyme 2 times a week, and each pair of injections is delivered 6 weeks apart. A typical course of treatment is 6 to 10 injections. The downside is the cost of the medication and the fact that men are unable to undergo intercourse for 4 weeks after injection. A penile traction device called the RestoreX, developed by the Mayo Clinic, has been used in combination with Xiaflex. Men with Peyronie's disease using the RestoreX increased their penile length by almost 1 inch and reduced their curvature by another 10 to 15 degrees. Other injectable medications like verapamil and interferon have shown minimal benefit. Shockwave therapy is an investigational treatment that in some patients has shown improvement in the plaque size and curvature. Reduction in pain has also been documented with shockwave therapy. Penile traction therapy, in conjunction with medical management or Xiaflex or shockwave therapy, has shown additional benefit. My own observations show that a combination of Xiaflex, shockwave therapy, and RestoreX traction gives the best results. Surgical treatment for Peyronie's disease typically results in the straightening of the penis, but unfortunately results in a penis that's usually shorter due to the scar tissue. Patient satisfaction after application for Peyronie's disease is not high because the operation results in the shortening of the penis. The key takeaway messages: 1. Peyronie's disease is an acquired disorder that results in scar tissue on the inner lining of the penis, causing penile curvature, pain, and shortening. 2. Peyronie's disease resolves spontaneously only about 10% of the time. 3. Peyronie's disease occurs in 5% of men over the age of 40. 4. The only oral medication that's been shown with some efficacy for Peyronie's disease is pentoxifillin, 400 milligrams 3 times a day. 5. Injection of Xiaflex is expensive and requires long periods of abstinence, but it's FDA approved for the treatment of Peyronie's disease and does result in moderate improvement. Xiaflex works better when combined with the RestoreX traction device. 6. Shockwave therapy is a promising treatment with minimal side effects that seems to help a subset of patients with Peyronie's disease. This is Dr. Judson Brandeis. Thank you for listening. Please share this video, like it, and follow us on YouTube.